Hi, this is Dr. Kurt Wohler for Autism Recovery 101. This is Module 4 presentation. The topic is treating yeast, bacteria, and other digestive problems, which we'll get into. The reason I developed this presentation, this fits into pillar 3 of my 4-pillar approach, where we're looking at digestive problems and specifically problems with regards to yeast, bacteria, constipation, etc. But it's the yeast and bacteria and the toxins they produce which cause so many problems. This will be a presentation I think that you'll need to listen to more than once, and because there's a lot of information that I'm going to get into that I'll talk about. A lot of it's certainly written down in the slides, but I can't write everything down in the slides. So there'll be a lot of clinical pearls and tips and suggestions that come up just during the audio portion of this presentation. So we're going to talk about Candida overgrowth, a little bit about the complexity and toxicity, but more specifically getting into treatment options. Same thing with regards to Clostridia bacteria. And then we're going to switch over and talk about bowel inflammation, which, by the way, Candida and bacteria, including Clostridia bacteria, can cause. And then some different remedy options for improving that. There are a number of useful documents for this module. So this is in the document section of Module 4. An interesting handout called Taking Probiotic Suggestions. This is just it's a short article on the use of probiotics, whether to do them with food, not food, whether to take them with digestive enzymes. The bottom line is that we get natural bacteria through our food. So I prefer to have people take probiotics with food, although they certainly could take them on an empty stomach. It's fine really either way. And as far as digestive enzymes go, I think it's best as a general rule to separate the probiotics from digestive enzymes. That may not always be possible when it comes to just the scheduling of supplements. So if you have to give a probiotic with a digestive enzyme, well, you maybe alter a percentage of the probiotic, but not entirely. I have a handout on Clostridia Natural Remedy Protocol, which we'll go through in this presentation. Another one on die-off reactions, and this is sort of some tips and suggestions that you can do to help if there is any kind of die-off reaction that might occur when treating yeast or bacteria, which essentially is just an exacerbation of underlying symptoms and behaviors. Constipation remedies, that's a useful document. And of course you have the lecture slides in PDF and note-taking version to follow along with the information. As we discussed in Module 3, the organic acid test is a critically important test to learn how to interpret, and you don't have to, doesn't mean you have to become a biochemist. It's just having some working knowledge on what most of the markers indicate. So let's go back through a few things here. And if we focus again on a typical organic acid test, page 1, top section, yeast and fungal markers, this is a new slide, and you'll see a lot of markers are high. Remember, the most common marker that's linked to Candida is number 7, arabinose. This is fairly high at 127. Tartaric is also high. That sometimes tracks along with arabinose, but not always. And then we've got a few other things showing up. The carboxycitric, which, that shows up once in a while. 3-oxyglutaric, another indicator of yeast. What's interesting in this particular panel is number 2 and number 4 are also high. Those are specific for mold, specifically Aspergillus and Penicillium mold. The most common source is food. So moldy fruit, moldy cheese, moldy grains. I'll talk about that here shortly. So first off, why is Candida so complex? And the reality is that it is. It falls within this what's called a biological group of organisms under the category fungi. So Candida, Saccharomyces are examples of yeast. Aspergillus, Penicillium are examples of molds. And then of course mushrooms all fall under this category of fungi. And if we look at Candida specifically, it's really considered a commensal organism, which means it can be a normal inhabitant of the intestinal system. So it's a normal inhabitant in small amounts in the mouth and the gastrointestinal tract, and they figure about 80% of the human population harbors a certain level of candida, which researchers feel cause no harm. Now, you could put a question mark next to that. Doesn't cause harm. I think the reality is when you're looking at traditional scientists and conventional doctors, they don't really understand some of the unique complexities of candida. So I would really question whether 80% of the human population is fine with candida in the body. I think a lot more people are affected by it. But candida, infections have been associated with vaginal problems and skin issues and getting into causing fungal infections of the nails and the toenails. And then in people who are immune compromised, it's definitely a big problem. Matter of fact, when I was in my medical training as an intern, I remember taking care of a young woman who had intestinal cancer, had surgery, and she ended up dying because of a massive fungal infection. And I think in part it was because of the treatment that she had been under that had really destroyed her immune system. And I had no idea how many antibiotics she had been on prior to that. But again, we're not talking, the vast majority of people who have chronic candida just have symptoms. It's not a lethal problem unless you're severely immunocompromised. One of the other unique things about candida is its ability to become invasive in the body. And what I mean by that is candida generally exists in what's called a unicellular state, this sort of individual cells. But those individual cells can then start to grow these tentacles, what are called hypha. And these hypha are what cause the candida to start to invade the lining of the digestive system. And that's exactly what this slide is showing. We've got a Candida albicans yeast, and different factors in the environment, whether it's an antibiotic or different changes in the immune system of the digestive tract, can cause or trigger that candida to start to become more invasive. And it starts to grow these hypha, these tentacles, if you will. And it can actually pierce right through the tight junctions in the cell, causing leaky gut, or it can actually go right through a cell. And then it gets picked up by the immune system and triggers inflammation. And you don't see that type of scenario going on with bacteria. So here we have another slide that just shows that candida can start to cause this tissue change or cellular change level within the digestive system. It can adhere itself to different tissue structures. It produces a protein called adhesin. It can penetrate right through a cell, or it can go right through the space in between cells, which is called the tight junction. And that's in the digestive system essentially what leads to leaky gut. Candida also produces various enzymes. We know it produces an enzyme that breaks down collagen. That's why Candida can actually be associated with oxalic acid levels or oxalate problems. Candida can also produce an enzyme that breaks down that hyaluronic acid. And essentially that's that intercellular cement. If I was to go back, essentially that's what's happening here in this slide, is we've got this hyaluronic acid being broken down that's forming that tight junction between cells. So when we look at any given organic acid test and the arabinose is high, you know that there is some invasiveness going on, that certain percentage, we don't know what percentage is, but a certain percentage of the candida is invasive. And so it makes it a challenge to treat. Some of the chemicals that are also associated with the candida production have chemical similarity to other chemicals as part of our cell metabolism or our cell energy production systems. This marker I mentioned before, which is measured off the organic acid test, called tartaric acid. Well, it has a chemical similarity to this chemical here called malic acid, and another chemical does as well, citramalic acid. They're all very chemically similar. And why that's a problem is that Candida, because of its chemical similarity of these compounds, can inhibit certain enzymes within the Krebs cycle. The Krebs cycle is part of our mitochondrial energy factory that produces energy currency. And so Candida essentially can inhibit or slow down mitochondrial activity. And so you could put on your list of things that could lead to mitochondrial dysfunction, chronic Candida problems. And this is just another slide here looking at the Krebs cycle. This is this little sun-like object here is the Krebs cycle. And we produce this compound called NADH, and NADH is what's really responsible for helping to spur on major production of ATP, which is the cellular currency at the cell level. Okay, so mitochondrial problems can be associated with chronic Candida, and we talked about that in Module 3. So that's what this is showing. This is the Krebs cycle section of the organic acid test. One of the other toxins that Candida produces, and yeast in general, is something called gliotoxin. Now, molds also produce gliotoxin, and gliotoxin can have a profound effect on the immune system. What they can do is they can cause suppression of white blood cells, these cells called macrophages, which are they're part of the immune system that really is sort of cruising the body looking for things to attack. Gliotoxin can also suppress secretory IgA. Secretory IgA is the main immune chemical that we have lining our digestive system. Gliotoxins also cause a depletion of glutathione. Glutathione is that very powerful antioxidant that we have in our body and is often deficient with special needs kids. Now, if we go back and take a look at molds, remember I mentioned number 2 and 4. This, these two markers here, 2 and 4, are very specific for mold exposure, Aspergillus penicillium most commonly, and the most common source is food. Now, every once in a while it might be an environmental exposure. It could be mold in the home or mold in the classroom, for example. I had a situation years ago where a child kept showing up with high levels of these two markers despite the fact that we were treating for Candida and using botanical remedies. Well, it turned out that there was mold exposure. They had had a pipe break in the buildings, the two classrooms, and there was a pipe that broke over the summer and it caused mold damage. Usually off of an organic acid test, when this is present, again, I'm saying the large majority of times it's food, and sometimes will just go away upon retesting, and oftentimes when you use remedies like biocidin, for example, which is very common, I'll talk more about that tonight, to treat yeast, the mold markers disappear. So what I would say is if you use botanicals like grapefruit seed extract or biocidin or some of the other remedies we'll mention for Candida, or even if you're trying to treat the mold and it still comes back upon retesting a couple months later, and you've also looked at your food supply, really trying to buy fresh food, making sure things aren't moldy, it's likely an environmental exposure. There might be some mold exposure that's going on environmentally. So what about some testing options for Candida? I talk a lot about the organic acid test because to me it's much more specific to the presence of invasive Candida than other testing. Okay, so we know that arabinose is very specific for that infiltration across the lining of the gut. Now, you may be doing some food sensitivity testing. This is just a sample of the food IgG test from Great Plains. Great test to do for food sensitivity, and they do give a marker for something for Candida albicans, the IgG marker, but you'll notice that it's normal. By the way, this is from the same patient. So we've got very high levels of invasive Candida, but sometimes the IgG isn't recognizable. Now maybe that's because there's just an underproduction of IgG. Sometimes it's hard to say. And that's why I've always felt that the organic acid test is really the first go-to test for chronic yeast. Stool testing the same way. You can do a stool test, and I do stool testing, and think they're worthwhile to do, and they're a nice complement to the organic acid test. But you don't want to solely rely on a stool test to rule in or rule out the presence of Candida. Because honestly, it doesn't matter what lab it is. Great Plains, and Doctor's Data, and BioHealth, and others, they're all great labs. It's just that the Candida is complex and unique, and it just isn't always actively shedding in the stool. In this particular one, they were able to detect it, and when they can detect it, they do something called a culture insensitivity, and that's where they have a petri dish where they can place samples of different remedies, whether it's a medication or botanicals, in that petri dish to see what has a greater killing effect on the yeast. And that's what they did in this case. In almost every almost every comprehensive digestive stool test that I do in my practice for years, grapefruit seed extract always comes up high as far as a very effective remedy against yeast. So you could hedge your bet that if your child has a yeast problem, grapefruit seed extract is most likely going to be helpful without ever testing a stool test, for example. Nystatin is a medication I'll talk about shortly, is also usually highly effective against Candida. It doesn't mean that others may not be, but grapefruit seed extract just seems to be very, very effective against yeast. Well, what happens in most cases with the stool test is there's no yeast isolated, but the organic acid test shows that arabinose is present. This is from the same individual as well. So that's why I've always mentioned that the organic acid test, to me, has always been an entry-level test. It's an important test. And then if you really had to pick, you could only do one test to begin this whole biomedical process. What would it be? It would be the organic acid test. What about some treatment options for Candida? Well, as we've talked about through this course material, you've already implemented many of the basic foundational supplements, right, with a starter packet, for example. So you're already starting to support the underlying nutrition and health of your child. Essential fatty acids, different vitamins and minerals, calcium, magnesium. And now you may already have your child on, or may look to incorporate some type of probiotic. And we'll talk about some probiotics here shortly, because there's some different uses of probiotics that you need to know about. There are some additional supplements to consider for Candida. These are not always a have-to, but sometimes they can be helpful. Biotin, for example, is known to actually slow down the invasiveness of Candida. Biotin is often used when oxalates are high as well. So I think biotin is a reasonable thing to add on. A milligram, 2 to 3 times a day. So anywhere between 2 to 3 milligrams a day can be useful. If the mitochondrial markers are elevated on the organic acid test in the presence of Candida or bacteria, well, certainly most of the time mitochondria are being negatively influenced because of the yeast and bacteria, but doing some mitochondrial support, as we discussed in Module 3, is certainly reasonable. There are a number of high-dose probiotics that can be useful for various things. The VSL-3 is a common probiotic often used when oxalates are high, and I'll mention more of that when we get into the dietary module for Module 5. Probio Premium is a high-dose probiotic as well. Both of these are useful for high oxalate situations, or let's say your child has been on an antibiotic. A lot of times these are used for a week to 2 weeks afterwards to really sort of flood the digestive system with high-end probiotics. They can be used as maintenance too. I mean, it's certainly reasonable. Something like the Probio Premium It comes as packets. It's 225 billion organisms per packet. And there's been situations where I've just had people take a quarter to a half a packet. Most of the downsides to probiotics are just bloating and gas in some individuals and loose stools. If you're using a probiotic at whatever level, whether it's a high dose or a medium dose probiotic like these two here, and you see loose stools, well, the thing to do is just cut back. Maybe you just cut the dose back by a half, for example, and not oftentimes will remedy the situation, because if you sort of overdo it on probiotics, that's what you get. Often you get loose stools. These two probiotics come from New Beginnings as well. They're fairly similar. The Probiotic Support Formula and Therabiotic Complete. The Probiotic Support Formula you generally can get on your own. The Therabiotic Complete does require an access code off their website, which is NBNRX. I oftentimes just have people get the Probiotic Support Formula, so they're not having to use any kind of access code for it. One capsule is 20 billion organisms. That's a pretty decent dose as far as just a general maintenance for probiotic use. Now, some people talk about rotating probiotics, where maybe you rotate every 5 days or 7 days. I think that's perfectly reasonable to do. The theory is that you're not using the same product over and over and over again. I don't personally have a problem with it. I've seen in some cases it be helpful. I can't say it's been helpful in all or necessary in all cases, but it's okay to do. When we're talking about yeast treatment, botanical remedies are really high on the list. And I already mentioned grapefruit seed extract. I really like this particular product from New Beginnings called Nutribiotic. It's very potent and it's very effective, but it does have a strong taste. It usually mixes well in some dilute citrus juice. So watch for that. You don't want to just take it straight, because it definitely has a little bit of a kick to it from a taste standpoint. It's difficult to give exact dosages for botanicals. Something like the grapefruit seed extract from Nutribiotic, 5 to 8 drops 3 times a day seems to work well for most kids. You can certainly go higher if taste tolerance is acceptable. On occasion, some kids get a little bit of an upset tummy from this. If that's the case, you can always cut back on the dose, or sometimes having a little bit of food in the stomach helps to buffer that. Another great product is the a+, and this is a nice complement to something like the grapefruit seed extract. It comes in capsules or drops. I will generally dose these at 1 capsule for every 5 drops, approximately. I mean, that's a kind of a general rule of thumb that I've used in dosing. How much to use? Again, it's kind of variable. So it may be that you just start off with 5 drops 3 times a day, or 1 capsule, and then increasing accordingly. There's been some situations where I've used 2 capsules 3 times a day. But oftentimes with these botanicals, we're doing rotations where you're tending to rotate the remedies so that there's not a resistance factor. And that's why something like the yeast control packet is it's a good option. So they designed this from New Beginnings to do just that, where you rotate amongst one different remedy every 5 to 7 days so that there's not a resistance building up within the Candida colonies. Black walnut, golden seal, a+, which I just mentioned, and uva ursi. How much to use? Well, again, it's kind of a range. 5 to 15 drops of each remedy 3 times a day is not a bad place to be. So I probably, with a real sensitive child, start with 5 drops, somewhere but usually between 5 to 10 drops. 3 times a day tends to work really pretty well. And the idea is to rotate amongst each remedy, again, every 5 to 7 days. Another remedy I really like is something called biocidin. I'll talk about biocidin in regards to yeast, but also in regards to Clostridia. The point is that these remedies I'm pointing out, you don't have to go on all of them. It's not like you have to go on yeast control pack and biocidin and the grapefruit seed extract. There have been situations where I have found it to be effective where I took that yeast control packet and then added the grapefruit seed extract to the rotation and just did that and rotated amongst these 5 different remedies for a couple months. You always want to come back and try and retest the organic acid test a couple months into a yeast treatment if you can. And I'll often have people repeat the test while they're on the remedies because I want to get a sense, are we making any headway? And also, are you also seeing improvement in your child's behavior, which we talked about in the last module with regards to yeast, the goofiness, the giddiness, the self-stimulatory behavior, the sensory-seeking behavior, which is often associated with yeast problems. Biocidin is a combination remedy. It's kind of like the yeast control packet, but it also throws in some grapefruit seed extract. So it's a combination remedy that can be used on its own. And I've used it on its own with good success in some cases. It does also have effectiveness against mold. So that's beneficial. And it has good effectiveness against a number of different bacteria. The way that I've dosed biocidin is a little bit different than the company and what they have, suggest off their website. But again, as a general rule, is 1 capsule for every 5 drops. And it's a strong remedy. The drops are actually tastes pretty good. They can go straight in the mouth, or they can be mixed in some water, dilute juice. All of the botanicals I minimally try and dose 3 times a day if possible. I mean, if the level is really, really mild, you're looking at a Ravenose that's 64 and the reference range is 60, I might be okay with doing something twice a day, but ideally 3 times a day if at all possible. This was just an example of an organic acid test. You'll see this slide again here shortly, where we used biocidin for 6 weeks, retested, and this particular child just happened to use 8 drops 3 times a day, but look at the Arabinos level. It was 161, quite high, and after 6 weeks, it completely normalized to 34. Now, one thing I want to caution you on is don't assume that you can just use these remedies for a few short weeks and then call it quits. Yeast, specifically yeast, is very complex and oftentimes difficult to get rid of or at least reduce. And I should say the reality is we're looking more at reducing it versus getting rid of it entirely. Because it's a commensal organism, there's always going to be some of it around. So you've got to be able to judge not only how your child is responding, but also what do the labs show, and not just treat the lab test, but understand, is your child gaining improvement from the yeast intervention. Candex is an enzyme that has a specific quality because it helps to break down the cell wall of Candida. So there's no potential for resistance to Candex. But it needs to be taken on an empty stomach, about 30 minutes before food or 90 minutes after food, once to twice a day. It doesn't interact with the other remedies. It doesn't interact with other supplements. It's one of those enzymes that maybe you can make a case if you're using probiotics, maybe you want to separate them. Okay, I think that's a good rule of thumb. But it can be an add-on remedy to this overall Candida approach. And there are some people who definitely feel that it is beneficial. It probably also has some effect on biofilm. Biofilm is this film substance that gets produced by all of these organisms that is somewhat of a protective mechanism for the colonies of yeast or sometimes the colonies of bacteria as well. The nice thing about something like biocidin, by the way, is the research on biocidin is that it was actually effective at breaking down biofilm itself. So I find of all of them, I really like the biocidin combo. And then as an individual botanical, the grapefruit seed extract is really top of the list. Now, at times, medications are needed. Nystatin is really sort of the first place that I start with regards to prescription medications. And the nice thing about nystatin is it doesn't get absorbed to any significant degree from the digestive system, so it doesn't cause any long-term liver stress. And it can be taken for prolonged periods of time, and sometimes the response is dramatic. As an oral suspension, it can be made in different concentrations or different amounts, right? So, for example, most nystatin comes as 100,000 units per ml. Well, 5 mLs is 1 teaspoon. So anywhere between half to 1 teaspoon is a pretty good starting dose. It's not dosed based on age or weight. So that's the other important thing about it. It's not something that is linked to specific weight. So it's generally a general starting dose. Again, I'll typically start, with little kids, small, little kids, 2 or 3, maybe at half a teaspoon, older kids at a full teaspoon, and then work it from there. It does come as a tablet as well, but the oral suspension is much more user-friendly for a lot of kids who can't swallow tablets, and it can come from different compounding pharmacies too, where they don't put so much of the dye and the artificial flavoring into it. Diflucan is also called fluconazole. This is more of a systemic antifungal. These are nystatin and diflucan are prescription only. And usually this is used for a shorter period of time. So 15 to 30 days, for example, to try to really knock the yeast levels down, and then switching back over to something like nystatin or some botanical remedies moving forward for a longer period of time. You don't want to stay on diflucan for prolonged periods of time unless you're doing some repeated blood work to look at liver enzymes. There's a slight chance of liver enzyme elevations with diflucan. It doesn't happen all that often, but it is something that you need to be aware of, and certainly your doctor would be aware of in prescribing it. So diflucan tends to be used in short spurts to really cause sort of a diminishment of the overgrowth of candida, and then over a longer period of time from a maintenance standpoint, something like nystatin or just botanicals are more useful. One of the things to watch for is die-off and the die-off symptoms. This doesn't happen with all kids, but in some it does. And usually die-off is just an exacerbation of the underlying problem. So if somebody had candida and they were fatigued, they'd feel more fatigue initially. If they had rashes or body itching from candida, those become exacerbated for a period of time. Usually die-off kicks in at about 48 to 72 hours into treatment, and usually will last anywhere between 3 to 5, maybe 7 days if it's going to occur at all. In most of the kids with die-off, you'll see hyperactivity, you'll see some moodiness, sometimes irritability. I very, very rarely have ever seen fever or vomiting or nausea from die-off in special needs kids. There's a document in Module 4, which I had mentioned at the start of the lecture, called Die-Off Reaction Management. This is just some suggestions if you see an exacerbation of underlying yeast symptoms. Some of these are a little bit easier to use in kids than others. The one that I've used most commonly is the activated charcoal. Now, activated charcoal can be found at most health food stores. New Beginnings also carries activated charcoal. Usually 1 capsule twice daily, sometime in the afternoon and in the evening before bed. And what the charcoal does is it helps to bind up toxins in the digestive tract that prevents them from being absorbed. Now, if you're going to use charcoal, make sure you watch out for constipation. In some individuals, the charcoal can stimulate constipation, so an additional 200 to 400 milligrams of magnesium, preferably magnesium citrate, can be helpful in preventing against charcoal-induced constipation. Epsom salt baths may work. Ascorbic acid, for little kids, it's kind of hard to get really high doses of ascorbic acid in, but I think probably your best bet is, in most circumstances that I have found, is the activator charcoal. That seems to be the thing that tends to work most consistently well. What are some steps to take prior to antifungal therapy? Well, you've already done that if you've been sort of following along and doing dietary intervention. You started your foundational supplements. For example, maybe we start to add in a little bit of biotin, but that's not an absolute must. Even just the foundational supplements are often enough, and the dietary intervention is often enough. The biggest thing is evaluate your child to see if they are constipated. If they have a history of constipation, you want to try as best as possible to remedy it as best as possible prior to starting anti-yeast or antibacterial treatment. And it has to do with the fact that if they're constipated, there is always the potential that when they start killing off the organisms, there's die-off material left over that it has no place to go. Okay, so if they're not moving their bowels on a regular basis, those toxins can stay in the body, and those sometimes can trigger an exacerbation of symptoms. So, and everybody's a little bit different, and it doesn't necessarily mean that constipation has to be resolved completely, but ideally your child should be having a bowel movement at least once a day. Magnesium and magnesium citrate and magnesium oxide are two forms of magnesium often used for constipation. They're poorly absorbed, which means they actually can have a laxative effect. I'll often have people take those at bedtime because it can help with a bowel movement the next day. The two things that I do most commonly is magnesium citrate, and then oftentimes I'll add slippery elm. Slippery elm is an herb. You can find that at most health food stores. It's not dosed on age or weight, but anywhere between 3 to 6 capsules, or if you do a powder, 1 teaspoon. Slippery elm helps make the stool more slippery. It's easier to evacuate. So sometimes just the magnesium and the slippery elm will do the trick. At other times we need a more potent form of magnesium. The oxy powder is a good form of that. There's actually oxypowder.com is a website, and that is specifically marketed for constipation. Fiber, sometimes needing to do enemas, might be necessary. I try, if at all possible, the last resort, to use something like Miralax, which is an over-the-counter laxative, only because I don't think it's all that healthy, and I personally don't want to see people be using it more than a couple weeks. The problem is a lot of kids, and constipation is a complicated problem, where you've got some kids who behaviorally are overriding their body's natural process of having a bowel movement, and that tends to be more of a problem with regards to behavior. So you have to get a behavioral therapist involved. But if your child has sort of the typical constipation where they have the urge to go, but they just can't get it out, oftentimes the magnesium or the slippery elm can be very helpful. And even probiotics. Remember I mentioned that sometimes if you overdo it on probiotics, it can cause loose stools. Well, that could be not a bad thing for somebody who's constipated, because it can have a laxative effect as well. Okay, so let's switch gears now and talk about bacterial overgrowth, specifically the Clostridia bacterial toxins. So here's a real busy organic acid test. This is the bottom section of page 1. And you'll notice that HPA is quite high. That's related to Clostridia. But we've got a number of other markers that are high too. Okay, so these other markers can be related to other types of bacteria. This happens to be a test that comes from a child out of China. I do some contract work with the people who do testing in China. And we can see the HPA is very high. And remember, I talked about how Clostridia bacteria can inhibit or interfere with dopamine levels in the brain and nervous system. And that's what's happening here, is we're getting an inhibition of that enzyme causing this dopamine marker to go up. And that has been associated with irritability and agitation and aggression and self-injurious behavior in severe cases. So both for creosol, coming from Clostridia difficile, and HPA can inhibit this dopamine enzyme called dopamine beta hydroxylase. What that will do is it will cause the dopamine levels to go up and then spill over as excess HVA, something that is looked at off the organic acid test. That doesn't happen in all cases when Clostridia is present, but it's worth noting. And so if you need to review that, go back and look at your notes from Module 3. Another fairly common marker that shows up, not always, but sometimes, is this marker here, 4-hydroxyphenylacetic acid. And it's interesting, this also comes from Clostridia, so it can be an indicator of Clostridia too. It can be an indicator, possibly, I don't want to confirm this in all cases, of certain parasitic infections, and just what's called small intestinal bacterial overgrowth. So that's a, in quote, possibility. But the reason I put it here is that it too may inhibit that enzyme that allows dopamine to be converted to norepinephrine. So it too may also be a contributing factor to some of the behavioral problems associated with Clostridia. Okay, so here it is right here, 4-hydroxyphenylacetic acid. And this is an individual who's got quite a bit of bacterial toxins going on. They've got Clostridia going on. They've got a wide variety of other bacterial toxins. There's also a marker on the organic acid test called DHPPA. Now, some of the labs who do organic acid testing will actually talk about DHPPA as being an indicator of toxic Clostridia. It's not. It's not a marker of toxicity. It's actually a marker of active, normal activity of bowel digestive bacteria. And so it doesn't have it's not having the inhibitory effect on those nervous system and brain chemicals like the HPA or the 4-creosol does. It's also sometimes, but not in all cases, seen when people are taking a lot of probiotics. Okay, so it's the HPA that's most specific for problems, and it's the 4-creosol that's also most specific. That's what's causing the elevation of the dopamine, not the DHPPA. Turns out that DHPPA is also an antioxidant. Okay, so it's interesting. There's been a lot of confusion because DHPPA sounds like HPA. They're kind of chemically similar, but again, if you see it on the test and it's slightly high, it just indicates that there's just some activity going on of normal digestive bacteria, or it could be because you're giving a probiotic. Well, let's talk about some treatment options for Clostridia. If we're talking about antibiotics, well, there's really two primary antibiotics used, something called Flagyl, another one called vancomycin or vancomycin. Admittingly, these are often used more commonly when we've got an individual who has severe behavior secondary to their Clostridia. There's aggression, there's self-injurious behavior, there's, they're a danger to themselves. Okay, the situation is very, very severe. I am typically personally not using antibiotics for just sort of more mild cases. And it really doesn't matter on the level either of the marker. To me, it's the severity of the person's response to Clostridia versus what the level on the test is showing. Now, usually in the traditional way of treating Clostridia, either one of these antibiotics are used for about 10 days, and then they're stopped. What's been discovered, though, over time is that Clostridia is what's called a spore-forming bacteria, and the spores are not killed off by the antibiotics. So you have to get at the form that is more, whether you call it an adult form or a form that is more responsive to the presence of these antibiotic remedies. And what has been determined really is that there's a better way of treating Clostridia than just 10 days of treatment and then stopping, and that's doing a cyclical dose. So things are sort of rotated over time. And a protocol that I've used with very good success with these antibiotics is we use the antibiotic for 10 days straight and then do a cyclical dose every third day for an additional 3 weeks. So what that would mean is if I was using Flagyl, for example, and I was dosing it 250 milligrams, I would give 250 milligrams of Flagyl 3 times a day for 10 days. And then every third day thereafter, I would do another treatment day where I gave the Flagyl at 250 milligrams 3 times per day for that specific day. And then just did that for an additional 3 weeks. And then during the last week, I would come back and repeat the organic acid test, or what's called the microbial organic acid test from Great Plains. The microbial organic acid test is just a smaller version of the OAT. It actually looks at just the yeast and bacterial markers, because I'm really doing the repeat test to most specifically look for the Clostridia markers. And this approach was really modified and based on this research going back into 2005, where they were looking at the treatment of Clostridia difficile with vancomycin and what the recurrence rates were secondary to doing it just for 10 days at a low dose, first 10 days at a higher dose, versus tapering it over 25 days, versus doing a pulse dose over 30 days approximately. And so what we've done is just kind of modified that and maybe somewhat split the difference, sort of doing 10 days, which was the traditional way of treating the bacteria, and then doing a cyclical approach like that article had discussed over 3 weeks. And that seems to work very well. Well, I took that same information and then applied it to the use of botanicals. You saw this slide before. This was that child who had very high candida levels where we did the biocidin. Well, what I didn't show you was down here, they also had very high levels of the 2 primary Clostridia markers of HP, HPA, and 4-creosol. If you go back and look, what happened was, as we treated in 6-week period of time, almost every marker normalized. What it didn't say was what I did in this particular situation is I did a cyclical approach of biocidin. So I wasn't just using biocidin every single day. And I'm going to explain that here with a few other cases. So this was using botanicals against Clostridia. This was just a few cases from my practice over the number of years. This first case example was a child that had elevated levels of Clostridia, and they would have some behavioral issues associated with it. They would get more irritated, more agitated. And so we ended up treating, back at that time, I just did 10 straight days of vancomycin. I just, based on his reaction and his behaviors. And so we did that, and I also had some experience with this child of needing a little bit stronger than just botanicals, so we did some diflucan as well. But watch the Clostridia markers. So the Clostridia markers definitely went down. Now, the time frame between retesting was much too long. I would have rather had come back and retested within 6 weeks. In this particular case, unfortunately, it took 7 months. Okay, so that's why retesting is important, not to delay it too much. But Even so, the child responded well to the treatment, behaviors improved, was doing really well. We came back and retested, and the HP-HPA levels were still normal. Now they're high normal. They probably were a lot lower months prior. But by this time, he was starting to kind of reemerge with some of that Clostridia, irritated, agitated behavior, not as extreme as it was before. So I said, hey, how about we try something like biocidin, see if we can get an effect that way. And the parents were also amenable to that because the medication was expensive and so it was difficult to get. So we did it. So we did some biocidin. And what happened is I did it in a way that I didn't rotate it, okay? So we just gave it for a couple months on a daily basis. Now, when they came back, they acknowledged that they were fairly inconsistent with it. It wasn't something that they were real consistent with. So when we came back and retested, now his levels were much higher, okay? So, and now he's having more behavioral problems. So I then talked about this cyclical approach that I had learned about. And I said, well, how about we try and redo the biocidin, but we do it in a cyclical way, similar to this study that was done on antibiotic, doing it cycling that way. Now, what I've always done with regards to antibiotics versus botanicals, whenever I use a botanical to treat a bacteria or let's say a parasite, for example, I will usually use it for a longer period of time than the antibiotic. So I just happen to choose 14 days versus 10. So remember the flagell or the vancomycin was generally dosed at 10 days straight. I just chose 14. And instead of doing it for 3 weeks, I chose 4. Okay, I just sort of picked that number, so let's run with that. And I said, let's try it and come back and retest. And I said, listen, if it doesn't work, we're going to unfortunately probably need to go back to an antibiotic. So we're sitting here with a level of 426 on HP-HPA, and we implemented this cyclical approach. And sure enough, come back about 5-6 weeks later, the level is totally normal. Come back and get another organic acid test. About 3 months later, the level is still normal. It's creeping up a little bit, but it's still normal, and his behavior is doing really well. Here's another case, okay? By the way, TID stands for 3 times a day. BID is twice a day. QD is once a day. That's in pharmacy terms. Okay, same kind of thing, right? In this case, though, we had the creosol was high. Number of other bacteria, but the creosol was high, so it's a different type of Clostridia strain. So we implemented this rotation, came back, let's see the date. So this was in June. Came back a little bit longer than I'd like on retesting, but anyway, that was the way it was. But the levels normalized, and the child's behavior definitely improved. Okay, so what are some general recommendations on oat testing? You want to obtain an initial organic acids test, obviously, to look at all the different factors of yeast and bacteria, specifically Clostridia and others. If Clostridia is high, then initiating some type of intervention is worthwhile in my experience. And I think that the severity of it is going to be determine what type of approach you take. In the vast majority of cases, I found doing botanical intervention is all that is often needed. So, but if your doctor, let's say, initiates an antibiotic for just 10 days, okay, if that's the way it's going to be, try and come back and repeat something like the microbial organic acid about 2 weeks after. Okay, ideally again a couple months later to make sure the levels are staying low. If you do more of an extended cyclical program, then what I like to do is do either the organic acid or the microbial organic acid during the last week of intervention. And I want to see, the reason is I want to see if we're getting a good effect while the child is on the remedies. If it's totally normal, we'll come back and repeat it again a couple months later. Okay, so let's talk now about just bowel inflammation. And we realize now that these organisms can trigger bowel inflammation, particularly chronic infections. The food sensitivity part of this will come in Module 5. We talk more about the dietary issues related to autism intervention. So the overall goal of really improving gut health is to first off, strengthen the first line immune defense. I mean, the lining of the gut is our first line immune defense, and it is our first line against pathogens. So if there are pathogens down there, we need to try to reduce or eliminate them as best as possible. Dietary intervention is going to be key in that. So part of this goal of mucosal healing also incorporates the dietary end of things. Of course, healing it allows for better absorption of nutrients, and of course, all that then supports your child's underlying, body chemistry and health, so that they can, move forward. A couple things that come up that can be useful, that have a real nutritive effect in the gut. Bromelain is derived from pineapple, and its primary purpose is as a digestive remedy to help control intestinal inflammation. It also has an anti-inflammatory effect and has actually been shown in adults to help prevent against things like strokes and reducing high blood pressure. So you'll often find bromelain in a number of different combination remedies for the gut. Now, glutamine is also an important nutrient for the digestive system. It's actually the preferred fuel source of the cells that actually line the GI tract. And it's also important in helping to produce healthy levels of this secretory IgA, that main immune chemical in the gut. Now, there's controversy about the overuse of L-glutamine in autism because some people feel that it may overstimulate the nervous system. But I think the reality is, in just small amounts and reasonable amounts used for digestive health, it's generally just fine. This particular remedy, methyl sulfonylmethane, is something that is incorporated into a number of different combination remedies for digestive health. And what it helps to do, it's interesting, is that it prevents the binding of certain pathogens or allergens that get into the gut from adhering all that well to the lining of the gut. So you can almost think of it like it creates a barrier effect in the digestive system. And so it can be useful that way. Quercetin is something that is used as an antioxidant and also has anti-inflammatory effects. It helps to stabilize what are called mast cells. Mast cells is what releases histamine to cause allergic reactions. Quercetin is often found in remedies that are used for allergy, for example. This is a fantastic product that I've used for years called Support Mucosa. If you look at the ingredient list, it's fairly extensive. And so it contains a little bit of L-glutamine, contains some quercetin, contains that methyl sulfonylmethane, contains the bromelain, and it incorporates a number of other different remedies as well, which are also supportive for the digestive system. Now, this is the one remedy that's not available from New Beginnings, and I know I've talked about New Beginnings as a primary supplement company for overall remedies. So this would be something that would have to be purchased outside of New Beginnings. It actually comes from a company called Biomatrix at biomatrix1.com. Now, those dosages there of 3 capsules twice daily, 15 minutes before meals, is generally for adults. Difficult to come up with an exact dosage for kids because, again, it's not based on age or weight. But generally, kids anywhere between 1 to 2 capsules twice daily tends to work fine. Again, if they can't swallow capsules, you're going to have to open up the capsules, mix it in food or drink, which is generally fine. So this is a nice overall supportive remedy for the GI system. Now, support mucosa also contains some turmeric. Turmeric is nice because it has great anti-inflammatory effects in the digestive system, and they're also finding that it actually has some antimicrobial activity as well. New Beginnings now, as we switch back to New Beginnings, carries something called curcumin quercetin. Now remember I mentioned quercetin has an antioxidant, anti-inflammatory effect too, and it also helps to stabilize against histamine. So this remedy is good for allergy inflammation type of scenarios, could certainly be used if certain times of the year if allergy levels are real high, but it can also be a nice remedy for just digestive support because it will help to cut down on allergic reactions in the digestive tract and also help to cut down on inflammation in the digestive system as well. Or you can just get straight curcumin. Some kids are sensitive to quercetin. Okay, some kids are sensitive to other types of botanicals or plant substances where it makes them more hyper or overstimulated. These are called phenol sensitivities. And I'll talk more about phenol sensitivities in Module 5. So if you know your child has a phenol sensitivity, sometimes you need to maybe just go with more isolated remedies like individual curcumin or individual quercetin than more of a combination remedy where sometimes it's more difficult to try to figure out what remedy they're sensitive to. And so something like the curcumin 250 could be a good segue because it's just curcumin, and curcumin is shown to have a good anti-inflammatory effect in the gut. And interestingly is that curcumin has actually been shown to inhibit biofilm formation. So we get a dual effect that way with something like curcumin. Usually one capsule twice daily with food is sufficient. And the New Beginnings also carries this nice product called Intestimate. It is not as complicated, meaning it doesn't have as many ingredients as that support mucosa product goes. So if you've got a child that's pretty sensitive to supplements, this would be a very reasonable place to start. It is meant to support the health and lining of the digestive system. And, you know, a half to 1 scoop daily mixed in juice tends to work well. You could always go twice daily too, and then I've seen that be helpful. But as a general rule, starting off with something like a scoop daily is very helpful. And so all of these things can be, you know, beneficial with regards to just as digestive aid in helping with, you know, digestive inflammation. Couple additional options of some things to consider for digestive health. One is probiotics, which we've already talked about, but probiotics play such a major role in helping what's called bioconversion of nutrients for absorption and utilization. They help to crowd out the bad bacteria. They help to create a barrier along the digestive system. So they're a critical part of our overall health and in what we do. So as a general rule, these sort of middle of the road maintenance probiotics are very useful, and these, by the way, could be added on to your starter packet. So you could consider something like this to be useful as just a maintenance probiotic for overall health. You know, I kind of think of these probiotics like a vitamin for the digestive system. The other thing is fermented foods. Now, not the easiest thing to get into kids, but in time, the more you work at it, the more success you may have. Fermented products like cultured vegetable or kefir products are a natural source of good bacteria. They also help to adjust the pH, the microenvironment of the digestive system, making it healthier, less less, I guess you say, hospitable to the opportunistic bacteria and yeast, and more hospitable to the good bacteria. These things are also supportive in digestion as well. Camel's milk is a nice option. I wouldn't say this is an alternative to just milk for, cereal or your child to drink a big glass of milk every day. Camel's milk is really meant to be something more healthy and nutritive for the digestive system as well as their immune system. And here in the U.S., you can get camel milk from a number of different sources. You can go to camelmilkassociation.org, and they have a wide variety of different camel milk options. It's more pricey than regular milk. So it needs to be viewed as an immune supportive, digestive supportive remedy. But what I have seen, by the way, with camel milk is that kids becoming more tolerant of foods that they were sensitive to over a number of months after using camel milk, meaning that they weren't as sensitive to gluten or are not as sensitive to regular dairy after they've been on camel milk. So Julie Matthews, by the way, this is an article from nourishinghope.com, really great overview of the use of camel milk. And so I'd encourage you to read that article if you're interested in this more, because it's a nice sort of add-on remedy for overall digestive problems. And here's Julie's information. So Julie Matthews, biomedical nutritionist, this book here on the left called Nourishing Hope is a great overall book on just the general concepts of biomedical intervention. And then her Cooking to Heal book is where she's got recipes for different types of special diets, talking about a wide variety of things, goes through some different, cooking examples. So both excellent material. Fiber supplements can be helpful for many kids, particularly kids who have constipation problems. Now, True Fiber comes from New Beginnings. You can also find it online as well. And this is what's called a prebiotic, meaning it's essentially food for healthy bacteria in the digestive system. I kind of consider it to be like fertilizer for good bacteria. Usually about 1 scoop mixed in 8 ounces of water or dilute juice is very healthy. Again, it could be used more often. And what you'll often find is it's healthy and helpful for digestive function, particularly with regards to constipation. Okay, so as we get towards the end, let me just mention a few other things. Cultured butter, or specifically ghee, clarified butter, can be also healthy and helpful for overall digestive health. Clarified butter specifically has something in it called butyrate. And butyrate is very nutritive to the digestive system. You could think of butyrate almost like Velcro for the good bacteria. And in people who have poor butyrate production, often have much more problems from a digestive standpoint and usually have much more digestive inflammation. Butyrate is also called butyric acid. It's beneficial in clearing out high ammonia that's produced in gut imbalances. It supports against gut problems. It helps to improve the immune status of the digestive system. It's found in raw milk and butter, and as I mentioned, it's found in a product called ghee or clarified butter. Now, you can get it in different forms, calcium magnesium butyrate or potassium sodium butyrate. Usually the calcium magnesium butyrate may potentially cause loose stools. So New Beginnings actually carries a sodium potassium butyrate product, and this has worked really well. Again, kind of hard to give an exact amount on age or weight. However, 1 to 2 capsules to start with food, anywhere between 2 to 6 capsules per day with food is very useful as an overall supplement for overall digestive health, specifically if you know your child has digestive inflammation or poor bacterial levels, maybe that you've discovered off of something like a stool test. On average, I'm using anywhere between 2 to 4 capsules per day with most kids. So that is from New Beginnings Nutritionals. Now, if you need, assistance with regards to lab testing, we do have the website Lab Test Plus. This is where you can order a number of different labs and then have us review those labs with written interpretation and what are called action step suggestions. So labtestplus.com, we have access, or you'll have access to lab testing from a number of different companies, including or the Great Plains Laboratory. One thing to keep in mind with the information here, and I know it was a lot that we went through, the treatment of yeast is difficult. It's not an easy fix in many cases, and it's a combination approach of diet, various supplements, various digestive support supplements that we talked about, different sometimes remedies and botanicals, sometimes medications, and time. Okay, it's very rare to see yeast just disappear within a few weeks, and certainly sometimes within a few months. Unfortunately, in some kids, it's a sort of this ongoing recurrent problem. So the whole 4-pillar approach is trying to build health in the digestive system, build health within the immune system, all of the nutrition and things that you're doing so that your child's overall health and immune function is much more functional so that yeast isn't such a problem anymore. The same thing with the bacteria, but usually bacterial imbalances are generally easier to eradicate or control than many of the issues that go on with Candida. So you've got to have patience with it and understand that moving forward. So that is the information for presentation for Module 4. Module 5, we're going to be moving into the topic of biomedical diets. Which ones and why? We're going to talk about what are some of the different diets beyond just the gluten casein free. Which one's right in certain circumstances? And then more specifically, what's the difference between IgG, IgE, and peptide reactions to food? Because that tends to cause a lot of confusion for parents and also causes, honestly, confusions for health practitioners too sometimes, knowing what are some of the behaviors that may be linked to different types of reactions to foods. So we'll get into that. Of course, if you've got questions, you can post those to the forum and we'll get those answered for you. So with that, we'll close out today's presentation, and thanks so much, and we will see you next time.